Phoenix Home Care and Hospice. I choose Phoenix.
Hello, I'm Terry Tucker with Phoenix Home Care and Hospice, and I'm excited that you've joined us today for Why It Matters, a series that we put together at Phoenix to celebrate the moments that life gives us. I'm very excited today that my guest is Dr. Luke Van Kirk with Command Family Medicine. And we're just going to chat a little bit about what makes Command Family Medicine a unique opportunity here in the Springfield area. So talk to me about Command Family Medicine and why it is a different kind of offering than what maybe typical medicine is, typical clinics.
Yeah. So one big part that makes us different is we don't take any insurance, and so that helps simplify things and help us provide more or better care. So basically how we're structured is direct primary care. So patients pay us directly, which like I said, makes things a lot easier. And they just pay us a flat monthly membership like you would a gym membership. That gets them basically as many office visits as they need. They can text, email, call us anytime. Usually can get people in a lot faster, same or next day. And then when they come in, their appointments aren't rushed. Your appointment time is your appointment time. You're not double or triple booked with anybody. You're not sitting in the waiting room for an hour or two. You get in, you're waiting maybe 5-10 minutes at the most if we're having a really busy day.
That sounds a little bit like heaven.
Right. So you don't have to take a whole half day away from work or a whole day away from work just to go to the doctor's office. And then when you're in the exam room, new patients get at least an hour, hour and a half scheduled, and return patients we always schedule for a half hour. Plenty of time to talk about any issues that you need to.
So it doesn't have to be just confined to that one issue that brought you in, is that right?
Right, yeah. So there's no more, we got to do that in another appointment. Generally, we're going to have enough time. If something like, and I also had this come up, so it leaves room for those, by the way, questions.
Yeah, we can have a conversation.
That typically physicians dread, but with us, we can make room for that, and it's not
right.
a big
And
deal.
while I'm here,
Right.
Exactly.
So,
well, I look at my situation. I have a couple of kids. I have a husband. We have insurance. Mm-hmm. So am I a candidate for Command or not?
Absolutely, yeah. So how I tell people is basically with our style of practice, it allows you to use health insurance like true insurance. So in America, we've gotten skewed and gotten away from insurance with health insurance. If you had, spending money on tires with your car insurance,
wow.
Your car insurance premiums are going to be way up if you're having to pay something that often that you can expect to happen. For most people, primary care, you can expect to have to use it. And so by trying to insure it, you're making the costs go through the roof. And so this just allows people to switch to a higher deductible plan. So lower the premiums that way, make room for our
what a
membership.
Great idea. Yeah.
And most people, the premiums are getting the deductibles are getting so high nowadays anyways, you're going to be paying out of pocket for a majority of your primary care regardless.
Right. All your tests and stuff.
Right. Most people aren't going to hit that deductible, so you might as well pay for real high quality primary care. And on top of the increased service and time that you get to spend with us, we also provide medications and labs at wholesale prices. So again, that helps make going into a catastrophic insurance plan easier because you don't have to worry about covering meds and labs.
Wow.
For the most part, we can get those 80-90% less than what they're going to pay other places. And then most procedures we can do in the office, we try to include in the cost of the membership. So if you need like a mole biopsy or a joint injection, that kind of thing, at most we charge for the medication or the tools that we use to do the procedure.
What a great idea. I love to watch you talk and to tell about it because I see your passion and your belief in what you do. Why did you go down this path? It's a non-traditional path for a doctor.
Yeah, so when I started my residency in family medicine at Cox, like a lot of residents, they find out pretty quick that they're not getting to spend very much time with their patients. Even at the beginning of residency, they give you more time. But even still, that's generally not enough what they give you, and you get patients that are waiting an hour or 2 hours. You're in there with one patient, but you have 3 waiting down the hall, and so it's really hard to focus and give the patient that you're in front of the attention they need, and then you only get to give them 5 or 10 minutes. And so it's just really frustrating. It's like, this isn't how I want to practice or treat people. And so my plan initially was just, I'm not going to go into outpatient primary care at all. I'm just going to go work jobs here and there in ERs and make
Right.
money, but I'm not going to do
Not
what
gonna
I
have that
wanted
pressure,
to do.
yeah.
Yeah, I don't want to practice medicine that way. And so then I found out my cousin, Josh Umber, he started a practice in Wichita called Atlas MD about 9 years ago, doing this style of practice, and found out what he was doing first year residency and talked to him for about 30 minutes, and I was sold. I was like, oh, this is exactly what I was envisioning, what I wanted to do with primary care.
Wow.
And so ever since I started residency and talked to him, that's what I've been planning to do.
The plan for you. So you really found your spot. I love that. You
Yeah.
found your contribution. That's awesome.
Yeah.
Thank you. Thank you so much for joining us. I loved hearing your story, and I'm very excited about what you're offering to our
Yeah.
community.
Yeah, thanks for
It's a
having
good
me.
job. And thank you for joining us today for Why It Matters, a service brought to you by Phoenix Home Care and Hospice. We'll see you next time.
Phoenix Home Care and Hospice. I choose Phoenix.